Let me illustrate the use of the value proposition canvas. We first start with the business model canvas, where we can find two customer segments: patients, the physician, and one key resource, the waiting room or the waiting rooms. So the problem we want to investigate is the waiting time of patients in the waiting room at the physicians before consultation. So you click the value proposition canvas, and here you find the customer profile of the patients. You can go back to both customer segments, and then afterwards you can select physicians and investigate their pains and gains and jobs to do. So the customer profile of the patient could be as follows. We indicated one functional job, spending the waiting time, some pains and some gains. So when we start with the job, you can give a description in more detail, and then you have a first assumption. Now, the assumption always starts with "we believe that." Well, we believe that the average waiting time in the average physician's waiting room is more than 15 minutes, but less than 30 minutes. As you can see, this hypothesis has already been validated. Why? Because we performed a test with some learning outcomes. Now, the test is, you have to click it, of course, and then you can see the detail. Okay, so what is the title? Yeah, of course, it's measuring the average waiting time in the waiting rooms of the general practitioners. And then you have some description, like you have to ask permission to the physician to stay in the waiting room during his or her consultation time. And you register the waiting time per patient. You label the patients anonymously, because you will also survey them when they are leaving after consultation. So you go to at least 20 physicians, and you start only with one segment, being the general practitioners, so not the cardiologists or other specialists. And the number of patients in the waiting room, waiting time per patient, those are your main metrics to be derived from this survey, this part of the survey. So you should at least survey 200 patients. You can also keep track of some extra information about the waiting room. So the success criterion is that the average waiting time is more than 15 minutes. Okay, so it's uncompleted. So the test has been done. And what is the learning outcome? Well, we observed that the average waiting time, 225 patients, 15 waiting rooms in Ghent, Brugge and Kortrijk, is 25 minutes on a 1% significance level, which is a very reliable result. So since this is a considerable waiting time, it is relevant to investigate how patients can spend their waiting time in a more useful way. That is interesting to go on with, for instance, the fact of wasting time and feeling bored or getting bored in the waiting room is also relevant. So you can click the pane, and again you go to the hypothesis. You formulate a hypothesis. Again, it has been validated because we did the survey of 225 patients. Here for the test we use a Likert scale. Yes. So how did you experience your waiting time? Absolutely a waste of time, up to absolutely not a waste of time. And then you formulate the success criterion, being a score less than 2.5 on the 5% significance level. So this again is a valid assumption. In other words, these are good elements in my value proposition canvas of the customer patient. So they do experience a waste of time, they have to spend a lot of waiting time, and you go on like that. So if you have an assumption that is not valid, like for instance learning moments, you may assume that since they have to spend a lot of time in the waiting room, it might be useful to broadcast some video content so that they can learn something. But maybe after surveying the patients, they don't believe it's relevant. Right? Okay, so every important assumption in your value proposition, canvas, and in your customer profile as well, has to be verified. If the assumption is invalid, you will have to reformulate the assumption or refine it. You can't have invalid propositions or assumptions in your business model canvas.